Welcome to this module on person-centered language for individuals who work in emergency departments. We will explore person-centered language in the care of persons with dementia and responsive behaviors. In this module, we will do the following. 1. Discuss dementia and responsive behaviors. 2. Define person-centered language. 3. Explore ways to put person-centered language into practice in the emergency department. What is dementia? Dementia is a progressive neurocognitive disorder. It is not just forgetfulness. Dementia is a significant decline in performance in one or more cognitive domains. These domains are learning and memory, language, executive function, complex attention, perceptual motor, and social cognition. Dementia is not reversible, and dementia is not a normal part of aging. The term dementia is an umbrella term encompassing several types of cognitive impairment. The most common is Alzheimer's disease. Responsive behavior refers to behaviors exhibited by people who are experiencing an altered cognitive state or impairment as they respond to internal or external factors. These behaviors are actions, gestures, noises, or words used by patients to express or communicate something important about their personal, social, or physical environment. The term responsive behavior has been introduced in healthcare settings in an effort to move away from labeling patients and instead encourage understanding about the meaning behind the behavior. It is to encourage providers to question, this behavior is a response to what, and to seek the meaning, thereby finding clues to address the behavior. Most people with dementia will experience some form of responsive behavior during their dementia journey. Almost 90% will experience responsive behaviors at some point in time. It is important to note that one or more of the following health conditions may be contributing factors in the expression of a responsive behavior: dementia, delirium, psychosis, acquired brain injury, stroke, and substance-related intoxication/withdrawal. Equally important to keep in mind is that the hospital and the ED is a challenging environment for persons with dementia, and that responsive behaviors typically worsen when the person is brought to hospital. The key point to remember is that all behavior has meaning. It is up to us to look beyond the diagnosis of dementia and seek to find the cause or meaning of the behavior. Desmond Tutu once said, "Language is very powerful. Language does not just describe reality. Language creates the reality it describes." In this module, we will be talking about the use of person-centered language when documenting responsive behaviors in older adults. So, what is person-centered language? Person-centered language is language that is specific, objective, and respectful. Let's begin by learning more about this definition. On this slide, we explore person-centered language in more detail. Person-centered language is specific. This means writing a brief description with precise details on the who, what, where, and when something has happened. Using specific language allows other team members to easily understand what you are describing, with less room for misinterpretation. Specific language enhances our ability to plan and evaluate patient care. It enables the team to implement interventions and evaluate their effectiveness through the use of clear details that are not open to misinterpretation. Person-centered language is objective. When we use objective language to describe our assessment findings, we use observable or verifiable facts and not personal opinions. What we write will influence the next clinician who interacts with this patient. The words used in a patient's chart can follow them throughout their stay in hospital and can influence the discharge planning process and access to long-term care. Person-centered language is respectful. This means using language that avoids labeling or infantilizing the patient. The language we use can promote, empower, and increase self-esteem, or it can demean, devalue, and disrespect those it refers to. Through our language, we can demonstrate a recognition of identity, personhood, and respect. Using specific, objective, and respectful words when we communicate with older adults means our conversations don't condescend or infantilize. On this slide, we look at some commonly used words which are not person-centered and don't provide enough specific, objective information to help us care for patients. Words such as confused, agitated, or aggressive don't provide enough information when they are used on their own, and their meaning can be misconstrued by others. Take a moment to read the examples on this slide. It is important to provide context and an explanation, as much as possible, so that there is a clear understanding of the behavior. When describing responsive behaviors, the key point to remember is, for a clear understanding of behavior, provide context and explanation. If you are thinking that there just isn't time for person-centered language, consider that responsive behaviors have an impact on staff. Clear and objective descriptions of behavior are important to being able to create solutions and care approaches. This can help to prevent escalation or triggering of behaviors. Take a moment to read the examples on this slide. If a person with dementia is trying to leave or resisting attempts to provide care, consider the impact of the unfamiliar ED environment. Using person-centered language when communicating helps build effective behavior support strategies. It may help you determine the reason behind the behavior and plan care that addresses it. If you hear colleagues using language that is not person-centered, try to ask for clarification. Avoid labels. Acknowledge that the behavior may feel challenging. Then rephrase using person-centered language. Describe the behavior using specific, objective, and respectful language to help the team provide care more effectively for the patient. Here we see language that labels. Mr. S is a spitter and provokes an emotional response. Watch out or you will get spit on. The alternative, using person-centered language, shares the same information, but without labeling or provoking an emotional response. Clear, objective, respectful. Take a moment to read the person-centered language on the right. As with the previous slide, here we see labeling and sensational, fear-based language in the first example. We are told that the patient is really aggressive and to be careful. Take a moment to read the person-centered language in the example on the right. Notice how the second example describes the behaviors with context in a specific, objective way. It also conveys a possible care strategy that might alleviate or prevent an escalation of behavior from this patient. Like the other slides, the first example contains language that is labeling and sensational. We learn that Mrs. B is inappropriate and abusive. Take a moment to read the person-centered language in the example on the right. In the second example, we have specific and objective information which also conveys a possible care strategy that might alleviate or prevent an escalation of behavior from this patient. As the preceding slides demonstrate, it is possible to share key safety/risk information and preserve patient dignity and personhood at the same time. Does using person-centered language mean that you must eliminate certain words like confused or agitated or aggressive? It may seem as if you are being asked to never use words like confused or aggressive in your documentation. There may be occasions when you will need to use these words, such as if they are part of a validated tool, legal form, or drop-down menu in an electronic documentation system. Using person-centered language means that when you do encounter situations that require you to use these words, you attempt to add specific and objective descriptions of behavior. This will reduce the possibility of labeling the patient and improve the chances that others will have a better idea of what is happening. In summary, recall that responsive behaviors are a means of communication for persons with cognitive impairment. One or more of the following health conditions may be contributing factors in the expression of a responsive behavior: dementia, delirium, psychosis, acquired brain injury, stroke, or substance-related intoxication/withdrawal. Having said that, All behavior has a meaning. It is up to us to determine, as best we can, what this behavior is telling us. When we describe behaviors, it is important to include context and explanation so that we can create care strategies. To support this, we need to provide a clear description of any behaviors using specific, objective, and respectful language. We can use person-centered language to communicate safety and risk in a way that protects personhood and dignity for our patients. We can harness the power of person-centered language to describe and document responsive behaviors in the emergency department.